to the One Nation listening tour. We are live tonight, and we thank all of you who are coming in from all around the country to be able to tune in and hear what independent presidential candidate Jade Simmons has to say about a new normal for healthcare. Tonight is all about discovering, what does that vision look like? What does it look like to have a healthcare system that works for all Americans? As we gear up to hear about what presidential candidate Jade Simmons has to say, you can expect her to cover some of those tough issues about healthcare expansion, but also the most pressing issue about the COVID-19 epidemic, the pandemic, and how it is affecting America, and some of the opportunities we have as a nation to address the issues that are going on in her future presidency. Tonight is about casting a vision. You will also hear from professionals in the healthcare industry. We have over 40 years of healthcare experience that will be joining us on stage tonight, and we're going to welcome those women later on this evening. But without further ado, I want to invite the first presidential independent candidate, Jade Simmons, to the stage. Jade, we welcome you. We're excited to hear from you tonight.
Hello, Isis. Thank you so much for that introduction.
Now you are on mute, so we're going to wait till you get your voice going. Let us hop in there and see if you're ready for us.
Check, check. Can you hear me now?
Oh, we'll give you just a couple more seconds. Then we'll have you all tune in. All right, go for it.
Can you hear me now?
I can hear you.
Okay, perfect. I am beyond excited about tonight. You know, when I think of where I am right now, you couldn't have convinced me 10 years ago that I would be this passionate now about some of these issues. And one of the things I always tell people is that when you connect with purpose, you realize very quickly that purpose is never just about you. You know, we're always out there saying, what's my purpose? What am I supposed to do with my life? But the truth is, when you connect with purpose, and people who've heard me speak have always heard me say that your purpose is not the thing you do. It is the thing that happens in others when you do what you do. And so when I think about just that statement, it strikes me now that we're all having to walk into that. As we look at what's happening, COVID-19, we're having to ask ourselves, what's my purpose in this? Where am I going to plug in and be a part of a solution? So I found myself, I woke up this morning and I was just extremely excited to talk about healthcare and to talk about really what healthcare should and can be from here moving forward. So I'm just really honored that anyone who is listening in may possibly feel something inside of them spark that makes them ask the question, who do I need to become to be a part of the solution? Not just where healthcare is concerned, but where leadership in this country is concerned. So I am very honored, humbled to be able to even have this discussion. And what I'm looking forward to most of all is to be able to hear from others. I want to be able to put out platforms and policy that sound like your voice, that sound like the issues you want us to focus on. I think too often we hear politicians tell us what we need and tell us what they think we want, but this is an opportunity for me to hear from the American people. So I'm excited about that.
Good, so good. And we are all looking forward to that. A leader who not only will speak to us or talk to us, but invites us in the conversation. So we look forward to the conversation tonight. So let's get it started. I mean, the title tonight is A New Normal for Healthcare. A new normal for healthcare. So what does that even mean? What could it look like to have a new normal in America?
Well, I've been saying for a while now, we have got to retrain ourselves because we keep saying we want to go back to normal. We want to go back to normal. But the truth is, why would we be in the midst of an abnormal situation, see the things that are currently broken, are not working, and return to whatever we were doing before? It's very logical and natural to say you want to go back to being comfortable. But I think the most powerful response right now is to look at what is uncomfortable, what's making us not be able to weather the storm as powerfully as we could. And then we have to determine what the new normal will look like. I think we've seen, the good and the bad thus far when I think about our status quo and where we need to go. I think our new normal has to contain what we've learned. What we've learned so far in this epidemic, and if I'm smiling so big, it seems hard to understand, it's because I'm so proud of what people have shown us. We've learned about the power of people. You know, we've been we've been getting afraid of things like artificial intelligence. We've been worried that people will be replaced. What we see right now is there is no replacing humans. Humans are our most valuable resource. I think we've seen the good in that we now are seeing the value, if we hadn't before, of our healthcare workers, our frontline workers, as we call them now. But we're also redefining and re-understanding the value of our teachers. We're understanding now the value of our parents, our grandparents. Hasn't it been wonderful to see how Americans, without being asked, have risen to the occasion to help each other? People are buying groceries for neighbors they may not have talked to before this epidemic. We are seeing the existence of more compassion. As a creative, I love the fact that we're seeing more innovation. And we're also seeing more local, national, and international concern for others. In a wonderful country like America, because we have so much opportunity available to a lot of people, it's very easy to get focused only on what we want to attain. And this has caused us to look at others around us. And I think it was a quick, fleeting moment, but for a little bit, we saw even a moment of unity in our government. We saw Republicans and Democrats work together. Very quickly, the bad we've seen, we've been exposed. You know, that's the long and the short of it. We've been exposed in our healthcare, where our healthcare disparities are concerned. We've seen socioeconomic disparities exacerbated. We cannot, no matter who your favorite politician is right now, we have to admit that we were unprepared. And that is no one person's fault. It's no one side's fault. We all were unprepared. And then we as American individuals did not respond as best we could initially. We also have to lay some blame at the feet of the media as well. I've been following the story of COVID since the end of December. I didn't see news coverage on it way back then because other things were being covered, like the impeachment, other issues. So many of us had opportunity to bring this into closer view, and we didn't. So we were exposed in a good way and in a bad way.
I like that. You used an interesting phrase. You said, okay, here's the good, here's the bad. Now, one of the things that we commonly say is the good, the bad, and the ugly. So yeah. Are there any ugly things you've been seeing with COVID-19 that maybe needs a little bit of a makeover?
Yeah, I mean, you know, the very nature of the profession that I have, that I work in, is geared towards being inspirational, to always looking for the silver lining, for always looking for the positive outcome. We must have that vision, but we cannot get to positive outcomes if we aren't honest about the things in which we are failing. And I think what was ugly, what was exposed, is we've been downright callous towards each other. The way that we've blown off the death tolls, even in our well-meaning, we've been trying to compare this to things like the flu, or say it's only going to be 1% or 2% of the population who dies. It's really easy for us to say when it's not our mother who's dying, when it's not our cousin who's hooked up to a ventilator fighting for their life. So callousness as well as compassion has been exposed. We've seen ugliness in the division. I really, sounds naive, I kind of knew it wasn't going to be the case for long, but my fingers were crossed. I thought maybe we would put aside politics. Maybe we would dare to prioritize people over politics and over partisanship, over election and over re-election, and we have not done that. We're watching right now politicking where life and death are concerned. So we've seen some ugly things: hypocrisy, inconsistency, misinformation, and demonization. And those are the things that we cannot take into the new normal. I feel like I always say, once you catch the vision, you can't unsee it. Once you catch a true picture of what a situation is, you also can't unsee that. So I think our charge is to take with us what we've learned about what's possible, and we have to leave behind the darkness that we see that we've created, the inequalities that we've allowed to fester, and we also have to leave behind the division that has been stoked. So our new normal, to me, is exciting, but we have to make the right choices moving forward.
That's right. And a lot of those right choices will be one of the key things will be surrounding ourselves with professionals and people who know, they know the industry. They've been in it for years. Their boots are on the ground, so they have that real life experience. And that's one of the things I'm excited about tonight. One of the things that we're doing, in addition to having Jade share about her policies and her platforms and the vision for healthcare, is we've invited two very special guests tonight. These are two doctors. I'll go ahead and introduce the first, and then I'll have her take a minute to introduce herself. But this is Dr. Felice Carlton. She is a doctor of nursing practice. She's a keynote speaker. She's also a certified integrative health coach through Duke University, folks. So this woman knows what she's talking about. She has over a decade of combined nursing and nurse practitioner experience. And Dr. Felice, will you just take a moment to tell us a little bit about yourself and let people understand a little bit about your background?
Sure. Originally from small rural North Carolina, and growing up, I realized that healthcare in my area was not what it needed to be. But oftentimes you don't know what you need until you see better. So going to college, University of North Carolina at Chapel Hill, top medical program, I noticed that my trailer back home, that was our healthcare clinic, was not standard, right? There was no education, there was no prevention. After college, I worked at the National Institutes of Health in Bethesda, Maryland, on the infectious disease unit. So Dr. Fauci, who's leading the country, I took care of his patients. From there, I've done travel nursing. I worked in clinics. I've worked as the only medical provider in a busy rural clinic. So every disease, every age, literally from conception to end of life, I've taken care of. So I'm just really excited to be here tonight. And I really want to give a voice to the underserved and those people who are often forgotten, or silenced, or ignored. So that's why I'm here today.
Awesome. We are honored to have you, Dr. Felice. And I also want to take a moment to invite our next special guest, and that is Dr. Carolyn Richardson. She's right here from Houston, Texas. She's a board-certified pediatrician. She's a fellow of the American Academy of Pediatrics, and she has practiced for over 33 years. Her particular interest is in asthma, and she is excited to be with us tonight. Dr. Carolyn, we welcome you to the stage. Oh, let's make sure we get you unmuted as well.
Yes, good evening. I'm excited also. I have been practicing pediatrics for 33 years. And my focus a lot of times was asthma, and I actually am more into preventive medicine. I really think that you have to get people to take some ownership in terms of trying to keep themselves healthy. And the way that works is through medical literacy, taking the few minutes to explain to people. A lot of times, if you just kind of put it in their language and use the words they're using so that you understand, you can get people to understand how to manage their own health. I did it I was in private practice for 8 years. I was in a solo private practice, and that could have been because I was by myself. I was like, listen, I have got to get these people to partner with me to take care of their health, because it's just me. It's just me. Yeah. So I found that if you give people medication that's effective, and if people feel that you care about them, they will follow what you're saying. Of course, you're always going to have people who aren't compliant, but people will follow what you say, and they do pay attention to what you're telling them. And if you give them, if this happens, do this, they can follow that.
That's right. That's right. It's kind of, you have to lead with heart first to make sure that people know that you care before they're able to receive that information. That's so good.
Well, actually, that's what they say. People don't care how much you know until they know how much you care.
That's right.
And if people feel that you care about their children, if you really have their interests at heart, they're more likely to follow your instructions and do what you're telling them to do.
That's right. Well, thank you, too, for giving us an overview of your background. I want to go ahead and pop off with a question that's extremely relevant for right now, which is COVID-19. I mean, we have a lot of gaps in our healthcare system being exposed. And when we see gaps, we realize there are actually opportunities, right? So I want to hear from all three of you. To maybe Jade, I'll start with you on that one. But what are some of the opportunities, so to speak, that we see with the healthcare crisis that's happening right now?
Opportunities. It's like I was saying about that new normal. If we look at the whole period we're in now, I keep saying, the root of the word crisis is change. And if we look at that as what's the opportunity for change, what's the lesson that we've learned? I think when what we've learned is that there were things that existed before COVID. There are things that have been exacerbated because of it. And we're not in any position to do anything differently if we don't talk about those issues for real now and look at them differently. So I see a great opportunity for change. And I also think because we're in a state of crisis, people are more willing to go further than they were before. I mean, look at how wild something like Medicare for All seemed to so many people. And even if you still don't believe in Medicare for All, you're going, we definitely need more healthcare coverage. We need to talk about this. So I think the opportunity now is that because we have everyone's attention, because we have a captive audience, we get to make more changes. And I'll let the two doctors talk more about some of the things they think we should focus on now, maybe things that were an issue before and have been exacerbated now.
Dr. Carolyn, would you like to start?
Okay. Well, I think one of the main issues that needs to be addressed is disconnecting insurance with employment.
Yeah.
As long as you have the majority of people who are insured have their insurance through their employment, that's a problem. I mean, we have millions of people unemployed now, and millions of people have lost their health insurance. So, I mean, they're talking about they think another wave may come in September or something. And now you have all these uninsured people. Where will they get their health care? How will they pay for their health care? Hospitals are already reeling from the expense of this round of treatment. So if we get another round, that's going to be a huge problem.
Absolutely. And just to piggyback off of what Dr. Carolyn mentioned in terms of insurance, another thing that a positive that what I noticed is insurance worked very well with the country and their needs. I don't know of any insurance that denied people getting COVID testing when they need it. As a clinician who has battled with things not being approved, I had a patient who I diagnosed with cancer, CTs, MRIs, everything showed that it was cancer. They needed treatment immediately with chemo. I had to fight with the insurance company to get this patient treated. I mean, we had the results, everything to show it. And the insurance company reluctantly approved it. A year later, the patient received a $120,000 bill. And the insurance company said, oh, well, we decided we were not going to approve it. So this person took out a second mortgage to pay for this bill. They lost their job because they were sick so much. They lost their job. Their wife was demoted, all this happened, and the healthcare is what really spun them into this spiral, So I'm so glad that the barriers were broken, but it shows me that it is possible in a daily clinical setting, that it should not be insurance versus provider or provider versus insurance. Like, how can we work together to make sure the patient that the provider is seeing and has the validation, the documentation, it really gets the care that they need.
You know what's powerful about that, Felice, is that one of the issues we deal with when we're trying to get anything done, the stalemates come from the demonization, right? You'll hear one side that will say insurance is all bad, and another will say, no, we love insurance. We got to keep it. We can't get rid of it. And you just in one breath said, hey, I've seen both sides of it. Mm-hmm. Is that kind of a clue that even the way we talk about this now needs to be more collaborative than combative? What do you think?
I agree. I mean, the thing is, the bottom line is we are here to help and save lives, right? Mm-hmm. I mean, yes, healthcare and insurance, they're all an industry. You have to have a certain amount of income and revenue in order to keep doors open, in order to provide supplies, provide staffing. But if you look at the bigger picture, the person in front of you is a person, is someone's mom, is someone's father. This is, it's a difficult decision. I'm sorry. No, it's difficult for the clinician to be that middle ground person when you see someone who truly needs help and they're not financially able to afford what they need. But on the back end, what's not being approved is maybe someone who's not in front of the patient. So I agree. Collaboration is what we need. It should not be a competition. It should be one industry that's meant to do one good thing,
Yeah.
Well, the other thing is that you can't have just black and white issues. You can't have somebody who just says, well, unless they hit all three of these boxes, we're not approving this procedure. Or, I mean, and you need to, if you have the medical documentation that's supporting the diagnosis, and this is established treatment, that should be the end of discussion. There shouldn't, you have, a lot of times I think what happens is that you have people on the front line, and sometimes you have to go past them. You have people on the front line who are making judgment calls when they just on a black and white issue, or maybe they don't even understand. I had a patient once. He fully fulfilled all the requirements for a post. He had a concussion during a football game, and the insurance company was denying it, and he had already been almost 2 weeks. He had still not recovered. So at that point, you need to, get some imaging and make sure nothing's going on. And the insurance company denied it. And so I got on the phone with the people and I said, listen, I just want you to know that we have documented in the medical records that, he needs this, and that we have done all that we can. If you want to accept the liability of not approving this imaging, that's fine. She put me on hold, went and got a supervisor, and then they approved it. So sometimes it's unfortunate, but sometimes you have to show them, this could end up in some kind of a legal matter. It could end up costing you money. If that's the way it takes to get it approved, sometimes you just have to go there.
I agree. And the thing is, we shouldn't have to fight, because if you're in that room fighting for something that should have been approved, there are other patients in the waiting room waiting on you who have and so there are other things that I feel as clinicians that would be better utilization of our time as opposed to fighting for something that, the documentation exists. But I agree with you. And it goes back to what Jade is saying. Let's collaborate instead of make this a competition. I know there's a goal of keeping costs down, right? We understand that. And I think maybe that's why so many barriers are put in place in order to make sure there's not so much overutilization for something that's not needed. But you also have to realize that Dr. Carolyn, you and I, we went to school a very long time, and years of experience. We know when something is urgent and critical versus something that, okay, let's find another creative way to really get what we need, but maybe something that's not quite as expensive, and even to have so much radiation on our patient or some other options.
Exactly.
Right.
That's so good. That's really good. I want to take a moment to also bring in our audience questions. This is a listening tour, so we love hearing from the professionals. We're excited to hear from Jade, but look, we want to hear from you. So please make sure that you're leaving your questions and your comments in the comment section so that we can address them. One of the questions that we have coming from Jersey Village, Texas says, what are your thoughts on adding more resources and attention to address mental health and the stigma behind the issue of mental health? Ladies?
I'll jump in on that one, only because I spent a good amount of years serving as an advocate for mental illness awareness, for youth suicide prevention in particular. And I had the honor in my early 20s to be a part of the rollout for the National Strategy to Prevent Suicide along with Surgeon General David Satcher. And what I remember at the time is that was a stigmatized issue back then. It's still a stigmatized issue now. It's better in some ways. And I think we will see that stigma presents itself different in different demographics and different communities. I think one area in particular where that is a hot button issue right now is in the military. We're sending our men and women to those front lines, quite literal front lines there, without that kind of support. And in that environment where you must be strong, if you equate mental illness with weakness, or even see it only as sickness, then we miss an opportunity. So I think, first of all, the national conversation on mental health must persist. Here's the key. It has to maintain itself as a public health discussion. It's not only something we talk about when violence strikes. If we continue to pair mental illness with violence, with school violence, with random acts of violence, we will continue to stigmatize the issue when we all know the percentages show that most people dealing with mental illness are not people.
Exactly.
So I think one of the first things we must do is change the discussion. I think civic discussion has to be our MO, our mode of operation moving into the future. And we have to stop politicizing issues when they are convenient for one side or the other and maintain a national discussion. That's my 2 cents on that. I'll let the doctors jump in there.
That's good. Dr. Belize?
Yeah, what I agree definitely with what Jade is saying. And I also think that like you said, having that conversation is important, but also realize that mental health is not different from your physical health. It is one thing. You are one body that is composed of physical, mental, emotional. It all plays a part into your health. You know, research shows those people who are under high levels of stress and depression, they're more prone to pre-diabetes, they have higher cortisol levels. You know, there's so many physical components that are composed of it. And I see in the clinical setting, especially working in rural North Carolina, it's not accepted. Right? You go to the doctor if you hurt. And so people will come to me and let's say their stomach hurts, you know, they have constipation, diarrhea, or a headache that won't go away, body aches that just seem generalized. And so I begin to ask, what's your stress level like? And then tears start to come down because for the first time, I gave them that permission to be the real transparent person of who they are, right? They can take off that armor. And then I'm doing a depression assessment and an anxiety assessment, and their numbers are through the roof. So then I have to destigmatize it because you have to realize whatever environment you practice in, you have to culturally be competent and meet the patient where they are. So for some people, they like to say, oh, I'll pray about it, X, Y, Z. And that's fine because if you open a door as a clinician, I'm going to walk down whatever path makes you feel comfortable. And so I also say, well, look, you know, if this were blood pressure and your blood pressure was 180 over 100, it seems like that's more acceptable for you because you have a number to quantify how bad it is. And this assessment is the same thing, you know, so just know that the symptoms that you're having physically, I can give you a tablet or prescription to turn on any symptom and turn off any symptom, but that's not my goal. My goal is to get to the root cause. Right. Let's figure out the root cause and address it in that way. And another thing we're going to have to consider when you're destigmatizing mental health is your healthcare providers now. They're going through they're going to have secondary trauma after all this is over.
Yes.
I'm in contact with some of my colleagues who are on the front line and who are constantly having to have that conversation that I'm sorry, your 39-year-old husband with these 2 healthy children did not make it, who walked into this emergency room healthy. And they're having to have that conversation multiple times. And because I've had that conversation, I know that it takes so much out of you because as a clinician, you don't just see a medical diagnosis on a ventilator. You see a father, you see 2 young children, you see a wife that's suffering, you know, and to do that over and over and over again. Right now, many of these providers are operating in an adrenaline rush. You just have to get it done. You're a survivor. You're here to save lives. You do what you can. You kind of decompress a little bit when you go home and then you go back again. But it will hit you later when you have time to reflect on everything that you have collected. So now is the time to start funneling resources in different areas. Having a conversation without having the finances to fund it is not helpful. And I've seen it happen where when people get to a breaking point, they're criminalized. I had to involuntarily commit one of my colleagues in healthcare. And it was devastating because coworkers saw it, right? And this person, you know, I had them treated they came to me. So backstory of this, their mother was brutally murdered unexpectedly. She was a minister, brutally murdered by the husband. She came to work a few weeks later. She was, you know, you could tell by looking at her, she was not her normal self. I did an assessment with her, had an emergency therapist to come to our clinic and to evaluate her. They deemed that she was not safe. And she attempted to commit suicide the morning of before she came to see me. And because my colleague did not want to go to the hospital willingly, you know, when you're not safe, you have to be involuntarily committed. That means a police officer has to escort you in handcuffs to the hospital. So you're criminalizing someone who has who needs help, you know, and this was her workplace. How humiliating and embarrassing is that? You know, it should not be criminal. Like no one's criminalized when their blood sugar is 800. Why are you criminalized when you're depressed? Yeah.
Yeah, I completely agree with what you're saying because I had a similar situation where I had a 16-year-old who was like in an acute psychotic crisis, was suicidal and everything. And she didn't meet the criteria to be transported by ambulance. So the only public vehicle they could transport her in was a police car. And the mother was like, and I was like, okay, why can't we just put her in a cab with a voucher or something? Why does she have to go in they said, well, she has to go in a public vehicle and she doesn't meet the criteria to be in an ambulance. So we will take her in the police car. Wow. And so again, that's something that needs to be addressed. And I mean, if you have an emergency psych admit, then we have Uber and everything now. Just dispatch someone, or maybe you don't want to just put them in an Uber car, but they should have vehicles or some way. You have city vehicles. They should have a city vehicle that can transport an emergency site case without having them to be transported in a police car. And so what I always tell people when I'm trying to get them to convince them that they need help, I'm like, if your leg was broken,
Yep.
you would get it fixed. Your spirit is broken and we need to get it fixed.
Absolutely.
So, I mean, that's what I had was one patient, she went to every specialist. Oh, it's my stomach. Oh, it's my chest. I said, listen, she had the affect of somebody totally depressed.
Mm-hmm.
But I was eventually able to get her the help that she needed. And once she got in with the therapist and they got her on the right medications, she was fine.
Mm-hmm. Absolutely.
That's so good. I think that really does, those stories really illustrate the stigma that needs to be removed and some of the ways that we take care of our patients to make sure that they are, treated with integrity and respect, just like with any other mental health issues. So thank you for sharing about that. I do want to move on to question number 2 for all of you, and that is outside of COVID-19. Before all this happened, what were some of the most pressing, I would say, can you share with us one of the most pressing issues that was on the healthcare scene prior to COVID-19? And if you don't mind, we want to make sure to keep being brief because I want to make sure we listeners as well.
We're all overflowing with content.
Right, we're all excited.
I wanted to make sure I had people who knew what the heck they were talking about and had personal experiences to go with it. So forgive us. Sometimes we may go on and on because we really are passionate about this.
Real quick. You gonna?
Yeah. I was gonna say the issue that probably Carolyn and I will end up piggybacking on is preventative care.
Yes.
And we're all nodding. Maybe we end up talking about the same thing. Preventative care. Carolyn, in a second, I want you to tell the story about the flight attendant that and where she gets her medicine. But I think what we have to come to grips with in the U.S., we sort of profit off of people's pain here. It's a very profitable industry. Being sick is very profitable in our country. Other countries who are footing the bill where their government has to pay for healthcare, you know what they do? They do their darndest to keep their people safe and healthy so they don't have to go to the hospital and partake of that government covered healthcare. So there's an argument to be made that if we can focus on if we end up focusing on covering more people, maybe that will press us then to make sure we're taking care of ourselves. I will say, and I know, Carolyn, you'll probably jump in on this as well. One of the things that we kept hearing about was how this COVID-19 really ravaged people with pre-existing conditions. So imagine if less of us had health conditions prior to this. Imagine if we had eaten better, if we, not just all on us, if we had better drinking water, cleaner air, cleaner water. Those are things that we sort of throw to the wayside, but now in crisis, we were exposed. And you look at even America with having such a high obesity rate that came into play. We're fighting about vaping. Maybe that shouldn't even be a fight anymore because we saw them say, listen, if you vape, stop vaping. This is the worst time to be doing that. So I'm grateful for the opportunity to talk about how do we care for our people now and keep them in the best health of their life so they don't have to partake so much of the healthcare system in the first place. That's my issue.
Dr. Carolyn, you want to?
Yeah, sure. I think truly the focus has to be on preventative care. I mean, like you alluded to, a friend of mine travels internationally. She's a flight attendant, and she gets some of the most effective over-the-counter cold medications outside of the U.S.
Wow.
She gives them to her friends, and they take it and that medicine really helped me. And I went to the Walgreens, and they were like, we've never heard of this. So she was like, I didn't get that from here. I got that when I was overseas. So it's true. When it's like you're saying, when you're having to pay for the people who are sick, you want to minimize people coming in using the services. So you want to encourage people to be more healthy. I was reading an article earlier online today when they were talking to this epidemiologist about, how COVID spreads with the children. And the lady said, she started laughing. She said, and a lot of these school bathrooms, there's not even any soap. So the children use the restroom and then they're not even able to wash their hands. So we're teaching them to wash their hands for 20 seconds. But if they go into a restroom that has no soap, what are they supposed to do?
Yikes. Well, just to piggyback off of these two amazing ladies, I agree. Prevention. But then when we start thinking about root cause, what are some of the root causes that these people have such chronic diseases? When you look at health disparities, you look at social determinants of health. Health is when someone presents clinically to us, they are a byproduct. Their health is a byproduct of their life, whether it's lifestyle, the environment they live in. If they don't have safe housing, they don't have good food to eat, they don't have social support. Many people are in survival mode, right? Those are the ones that present to you in what we call the medical train wreck situation. High blood sugars, high cholesterol, high blood pressure, everything's high, right? Everything that's supposed to be high is not high, and everything that's supposed to be low is not low. Right. And you look at it and you see this person doesn't have enough money to pay for housing for their family or their children or adequate childcare. So when we talk about prevention, it's very important, especially for those vulnerable populations. You look at the elderly, rural, inner city, people of color, whether your Spanish speaking is your first language, these are all different barriers, that we have to consider when we're looking at prevention, because prevention for the middle class, two-parent income with college degrees and master's degrees,
it's completely different.
It looks very, very different from the single mom that's working 2 full-time jobs just to put food on her table and keep the lights on for her kids. And coming from a rural area, I saw people who have college degrees that make $10 or less an hour, work full-time jobs, two of them full-time, like 2 full-time jobs, to leave one, do another one for 8 hours, and their children are still on Medicaid because their income is so low, they're still below the poverty line. So people like that are in survival mode. They're doing everything they have with everything they can with what they have. So how can we look at the full picture when we consider prevention as well?
So good. That's so good. Did you want to comment on that?
Well, I think one thing that would help to me, what would help is that the support that we give people, to me, should be withdrawn gradually. You have, I don't know how many times mothers told me they turned down a promotion because the promotion would have taken them above the cutoff so that their children could qualify for Medicaid.
Sure.
But it wasn't paying them enough.
That's right.
So that they could get the private health insurance through the company. So a person should not have to make a financial decision or cap their upward mobility because turn down a promotion because, well, if I take the promotion, it's not enough to get me to where I need to be and I'll lose what I have. So if we had a gradual, like if people could be supported 100%, then 80, 60, like some kind of prorated support. So that way this mother wouldn't have to turn down her from a promotion because she says, well, now instead of me getting 100%, I'll just get 80%. And her promotion would probably allow her to now contribute a copay that she didn't usually have to pay before. So if you have a gradual withdrawal of support going down at like 20% at a time, that would kind of help people move up and not lose their health insurance or health coverage.
And what Carolyn's talking about, we'll talk about even more. We're going to do a follow-up session on healthcare that specifically deals with the expansion of healthcare coverage. I know someone asked earlier or wanted to ask earlier about how do we expand to include more artists? People who they work a gig economy, right? So, which actually includes me in many ways as well. As soon as everything shut down, a large part of our revenue dried up because we make our revenue from being in public spaces. So what you're talking about, Carolyn, would also help people, like you said, who don't have the employer insurance, being able to kind of reach more people. And then lastly, I would just say, Felice, when we were talking offline before, you were telling me about how you worked in this underserved community, but if you wanted to eat healthy, you literally had no option right where you are. So it's one thing for us to say, eat better, then in your neighborhood are no options to do just that.
Right. And, I worked about 45 minutes away from where I lived, which still was somewhat remote. I would meal prep. So I would stay down there during the week, and I would take breakfast, lunch, dinner, and snacks with me when I went, because I knew there was not healthy options in my area. So just once again, I feel like everything is so intertwined. When you look at the social aspects, the environmental aspects, these people that I worked with were farmers. So they raised all this healthy fruits and vegetables, but it was not given to their community. It was sent out to other people's community. So they could not even enjoy the fruits of their labor.
Yeah. So I think a lot of what we're talking about also relates to the fact that there is also food insecurity now that's happening as a result of COVID. And I know we had a question come in about that in regards to how would you address food insecurity? Do you have any ideas about that, given the way that is going right now, and the inaccessibility, especially for our kids who don't have access to food right now?
Right.
I will say what I was proud of was when this issue was brought to light during COVID, because nobody was talking about this in the first few days. You remember, we were more worried about how to stop the spread, how not to catch it. And then I remember one commentator going on CNN, Alexis Glick was her name, and she really brought light to this issue. And suddenly, people paid attention to it. What I am proud of is that they pretty quickly, as far from what I can see, kicked in the same program that provide for kids during the summer. I remember growing up, my grandmother lived in housing projects, and in the summer, I didn't know what it was back then, but I'm remembering now what it was. It was called free lunch.
Yeah.
So during the day, we'd all go back and have free lunch, right? And my husband and I still remember what those lunches were. I didn't know as a little girl that those were lunches that were being provided because some of the very kids around me did not have lunch in their home. So I am proud that our country was able to rally and put those programs that are normally in place in the summer, put them to work. Here's what we learned, y'all. We learned, excuse my Texas and my South Carolina y'all there. Here's what we learned. We learned that when we want to do something, when we want to pay for something, suddenly we can do it.
Absolutely.
Suddenly we can do it. We were able to provide internet, devices for kids. We were able to get food insecurity dealt with during the year, not just in the summer or not just at school. And that's why I say we have this rare, small window of time to capitalize on crisis mode and make this our reality. How do we serve people like we've served them in the crisis into our reality? Then we'll truly be the wealthiest nation in the world.
That's right. Well, Jade, one of the things that I've seen from you and just watching how you speak about the movement and your policies and platforms, you're really open to looking at what other countries are doing well as well. And I think that's something that's a really positive thing. So can you tell us, have you noticed anything that other countries are doing well that you see that we can maybe be implementing or learning from in America?
Sure. I think, first of all, you have to have the mindset that there is wisdom and an abundance of counselors. And the counselors are not just the people that are in your cabinet. They're not just the people that you know. We should be looking at how other countries have handled things back in history, how they're doing it now. I know there was one moment where we were approached by another country that wanted to help us in the beginning of this epidemic, and we turned that help down because we wanted it all to come from American ideas. That's reinventing the wheel. In terms of healthcare in large, there are other developed nations that already, do things like Medicare for all. I know Bernie Sanders would always say, wait a minute, Canada has this, this country has this country has that, we should have it too. What I am careful to say is we don't just do something because somebody else does it. And we don't take exactly what they've done and just assume that we can place it on our model. I think we have to do something unique. The United States right now, I believe, 91% healthcare coverage. But if you look at Switzerland, Germany, France, Sweden, UK, Norway, they have 100%. And so when you hear that, you go, why aren't we doing it? Well, we have a lot of different populations that we have to address. And I think we have to be careful in addressing that so that we also can maintain what we've built as a capitalist society, but so that capitalist society doesn't exacerbate disparities that we have. Someone was asking about, how do you deal with just the for-profit nature of the industry? Well, that's a mindset that's been with us since the beginning of our creation as a nation. You have to work within the mindset of competition. So I believe a lot in incentivizing companies to do better. And the way you incentivize is you introduce a little bit of threat. And we'll talk about that later. But I do think there are other countries that are doing things well. In terms of the epidemic, Germany has handled it well. South Korea has been the model of testing. They never shut down. The reason was because they did extremely aggressive testing on the front end. They tested you whether you had a cough, a tickle in your throat, a sneeze, you got tested. And then if you were sick and didn't know it, you were quarantined. And so they were able to do what Carolyn always says is you got to know who's sick and who's not. And they did that powerfully. And so if we are thinking about reopening, we have to do the same thing as if we were at the onset of the epidemic as we begin to reopen.
Awesome. Another question that we had from an audience member is Shayna Prentice. She's listening in from, I believe, Facebook, and her question is, how will you address the for-profit nature of insurance companies, which tend to prioritize their profits over the health of their insured members?
Does anybody else want to take it?
I have some thoughts, but I want to kind of chime off of Jade, what you potentially would say.
Mm-hmm. Oh, what I would potentially say. So yeah. I think it was what I was saying just now about that for-profit nature. Mm-hmm. We can't pretend like part of the American dream isn't chasing down profit. It just is. And for us to pretend like suddenly people aren't going to care about income, revenue, and profit would be wasting time. So I think you have to create a very powerful sense of competition. I think what I would do when I look at, say, things like Medicare for all, if you look at rolling out even a single payer option, starting in the states that have insurance monopolies. So instantly what you're doing is you're incentivizing those insurance companies. Look, they may have to play a little bit more within the lines here. If you're operating with no boundaries, if there has been no need to have boundaries, then what incentive does an insurance company have to treat their people better? But if suddenly people have the option to opt into something else, right? They're going to do that. Now your insurance company has to say, wait a minute, we've got to become more attractive. Anybody in business knows that's what you do. You look at the competition, you say, well, we'll offer more. So remember, Carolyn was talking about those boxes we have to check. Maybe they'll make us start having to check much less boxes now when there's competition. Also by rolling it out, not as a blanket program, by having kind of test markets, you can see if this truly works for our nation. It's one thing to have it as a theory, but you're already, Felice, man, you guys are buried in paperwork, already dealing with all these things. Do we just want to dump something on you without really knowing how it works for us? So the reason I don't advocate all or nothing programs is because we don't have proof of what works here. We can see it worked in Sweden, but we're not Sweden. Sweden was a population that in their culture, they already do social distancing. So they saw a different effect from COVID-19. That's part of their culture is to be socially distanced. So they were affected differently. So I'm all about curiosity, competition, and incentivizing people to do better and to elevate up to a behavior that actually serves the American people.
I definitely agree with that in the sense when you consider with insurances, you also have to consider the leverage that they have because of how much money they pour into political campaigns or they pour into lobbyists and different things as well. So when we have to look at the whole picture of a group of medical providers standing up saying, hey, this is wrong, versus funding particular campaigns to make sure lips are closed when these discussions come up is a big deal. Another thing to think about is when they're talking about for profit. So the United States spends almost $10,000 per person on health insurance, and look at our healthcare system, so we spend more than other developed countries, but overall our outcomes are so much worse. And when we focus on a disease management system, which is what we have, right? Lots of money and research goes onto technologies, new procedures, how you can do this medication. You look at a bunch of different things in healthcare. It's not just insurance. There's pharmacy issues. There's a lot of issues that go into our whole picture. And when you prioritize the revenue generating strategies of, like you said, profiting on illness as opposed to profiting on wellness. I think about our little small community that I worked in. There was an incentive for people who did not smoke. If your blood sugars were below a certain amount, if you know, even if you were overweight, but you lost a certain percentage of your body fat, we all received a check every year just for that. If you got a flu shot, why? Because that was more so herd immunity to everyone around you, right? But then they had a separate program for those who were considered the high risk. Technically, that meant the ones who were costing the insurance company more money. So that program particularly gave them a different incentive. So there were different ways to look at it.
Yeah, I think that's a good idea to get people on board with kind of taking charge of their own health. Mm-hmm. And if you, as long as people are making money on all these medications because people are sick, you know, they don't want to see people get well. But the thing is that there has to kind of be a shift and say, okay, we're not going to. That's why the scripture says we need to beat our pruning forks into plowshares, because okay, we have these things. What are we going to do with it? So the pharmaceutical company needs to. We might have to show the pharmaceutical companies how they can still benefit even if people are well. Mm-hmm. Because if they see their revenue stream drop, well, if we get everybody's blood cholesterol's low, you know, our statin sales are out the window. Yeah, but maybe you need to get and look at some other way to generate revenue, as opposed to always depending on people being in the worst health possible.
Mm-hmm. That's good.
Agree.
I noticed Grace's question or her comment, so powerful. She says everyone deserves health insurance and quality health care at affordable prices, mm-hmm. especially those with chronic and serious health conditions. You know, we'll talk about, again, more of the details of the expansion of healthcare in another session. But Grace, what I want you to know, what's inspiring me right now is, as I have been just studying the Constitution more than ever before, I look at the Sixth Amendment, and there we promise people, you know, the right to a fair and speedy trial. We grant them a free lawyer. Some of them we know are guilty straight out the bat. They still get a trial. They still get the free lawyer. Yet we come to the table sick, in need of help, sometimes it being no fault of our own, and we have to fight to be covered. So I wonder now if we need to be reevaluating what the inalienable right to life means. Isn't healthcare intrinsically connected to our right to life? If we can provide free lawyers for people who need representation, we need to look at how can we provide more healthcare. I'm careful with the word free because nothing is ever really free. No. Mm-hmm. So what I like to say, Grace, so you'll understand my viewpoint on this, is that we must have healthcare for all, period, point blank. Anyone who disagrees with that fact, there's something inhumane about a person who says we shouldn't all have it. I think we all can agree on that. I think we can afford to do Medicare for more. I think we can also do Medicaid for more. And I think we can work within the confines of what ACA has already provided as well. I think the most dangerous thing to do is to throw the baby out with the bathwater and end up with more people being uninsured until we figure it out. So I think the first thing to do is work within the confines of what we have.
Mm-hmm. That's good. And along that same note, in terms of confines, you know, the president has laid out some phases for the U.S. in terms of reopening the after COVID-19. So here's the question of the hour: What are your thoughts on the reopening and really just helping our country recover economically?
I'm gonna go last on that one, or else I'll talk too long. So I'll let you other ladies go.
Well, I think it would just be good to know who is still a potential person who could get sick, and then who could be floating around who could get others sick.
Absolutely.
And since we haven't really established that, I mean, I just read an article that was written today, and that there has not been any sort of comprehensive way to identify who is contagious and who is not. Mm-hmm. And so, like you were saying, how did in South Korea. I mean, I guess because of the way their country is set up, their government is set up, things are different. But I think when we open, we have to be aware that there will be people who will be in these spaces who can get sick and who can infect others, because you can feel fine and look fine.
Absolutely.
And be shedding live virus that can infect someone else.
Agreed. And then when you consider that, you think about who in your family is high risk. I know I've been extremely careful because my mom is high risk. She takes a chemotherapy medication. So I've been extra careful on top of it. But when you talk about opening up, I'm interested to see what are the specific plans for widespread testing in every state, right? What are the restrictions that you're putting on the establishments that are opening up in terms of how are we going to still promote social distancing? When you open up schools, how is it possible for a school that was already overcrowded to have social distancing, you know? And what are some things that are going to be our new normals in terms of infection control and prevention, but also knowing that even if the government decides to open things up gradually, we as people have to use wisdom in how we conduct ourselves. And I don't want this to be one of those people have cabin fever, so let's go crazy, let's hang out, let's do this, because I don't see that going well. Not every place has already peaked. I was speaking with one of my colleagues, they're expecting their particular facility to peak around May 1st. So they're ramping up for that as the country's opening up. So there are going to be other isolated pockets that come out of this. When you think of things like rural areas, they're behind in a lot of things. They may not have that whole population cluster like New York had from the beginning. So there are other things to consider.
You guys are being very polite. When we talk about the reopening, which is important, I'm passionate about this topic. I consider myself, you said early on, Felice, that, you know, we need to, you're caring from people from, you know, before they even start their life, right, in the womb until the end of life. I believe that our nation, no matter where you stand on personal liberty issues, essentially at the heart of everything, we should be pro-human. We should care about the sanctity of life from the earliest phase of life, I say from the womb to the tomb. And because I feel passionately about the value of life in general, it is imperative to me that our leadership always prioritize people over profit, people over personal gain, people over partisanship, people over politics. And I don't think that's what we're having right now. So we're jumping into maybe a controversial part of the discussion. And I want to be open and transparent with you about what I believe here. I think we are making a mistake, not in talking about the reopening. It is wonderful to know that people are talking about this. These should be mostly behind the scene discussions until actual plans are able to be projected. Phasing is not a plan. Phasing is not a plan. Our first step must be to ramp up testing. Here's the hard news. We've been hearing and we've been putting all of our eggs in the antibody basket. We now know that there really isn't a ton of proof yet to show that having the presence of antibodies from COVID-19 actually makes you immune. They're not 100% sure, but we're already telling people once you have antibodies, we're good to go. We don't know that. Now you're talking about somebody who believes in faith over fear every day of the week. I believe that we need to have faith in our experts, in our public health officials. Even the economists say they are not the ones who should be making this decision. It should be made by people in the healthcare experts. So I believe one of the biggest factors that should determine when we reopen is in how many tests we have available. Right now, we test on average 150,000 people a day. Sounds like a lot. Experts say we need to be testing about 500,000 people a day in order to be ready to reopen.
Wow.
Like President Pence says that we have enough testing to get us through phase one. We must be, I saw someone, I think it was Kathy Taylor, said she's been reading a lot about finite games versus infinite games. We need more infinite game thinking. We're about to jump into a phase one without genuine preparations for phase two and phase three. I have a relative who is a principal, and she says her teachers are calling her saying, I don't know if we're coming back. Whether you open or not, we're not sure we're coming back. We're not sure we're bringing our kids back because of what Carolyn said with the asymptomatic issues. Imagine horror stories later of teachers spreading the illness to their
Children.
Imagine the horror stories. If we don't have a humanitarian aspect on this, throw that to the side. Think about it economically. If we reopen too early, what we do in a resurgence, we throw away all the progress we've made. We shut down the economy a second time while we are depleted of current resources. So we take those healthcare workers who are already feeling depleted and exhausted, Felice, and we put them back on the front lines again before they could even go home, mourn the people they had to help pass away, recover mentally, physically, and emotionally, and suddenly they're back in the middle of a resurgence. So I think as much as I want to jumpstart the economy, it would definitely help my business. It would definitely help payroll for me. But if we did that prematurely, we're looking at a future shutdown that's going to cost us time and money. So I think it's a logical thing to want to go back to normal. I think we need to be patient now, be more aggressive in getting what we need on the front end so that we have a good, sustainable start instead of a false start.
That's incredible. I think it speaks right to what a lot of Americans feel, right? We all want to go back. We all want to be back to our new normal or to an old normal, but we all want to be out and about again, but we want to do it safely. So I really appreciate your perspective on that one. One thing that I am going to do, Jade, I know tonight is about hearing about the vision of healthcare. And I know we have a question that's coming from Houston, Texas, from her name is TK. It says, what do you think would help millions of Americans recover from the COVID epidemic if you are elected? So one of the things I wanted to get into is what would be your pandemic, as you say, pandemic-proof healthcare plan? What would that recovery look like?
So when we get done with our amazing panelists, I would love to spend some time. We've been working behind the scenes on something I call the Daniel Plan for pandemic proofing the nation. Some of you smile, you know where that reference is coming from, which I'll explain later. But here are the basics of that. In addition to economic recovery, which is suddenly going to be all our focus. Watch it now, mark my words. We're all going to be focused on economic recovery and getting back. We haven't plugged the holes that we discovered. And what we haven't talked about is how do we pandemic proof for the future? And the problem is if all of the energy goes into getting back, then nobody's thinking about far into the future. So I do have a plan that I'll spend some time revealing at the end of this, but I want to make sure we cover everything with Dr. Richardson and Dr. Carlton as well.
Yeah. Dr. Richardson and Dr. Carlton, did you have any comments that you wanted to share in terms of the COVID epidemic or pandemic?
We've covered a lot.
Yeah. I'd be curious, Felice, I'd be curious if there were one thing that you hoped, and we can end on this part before I talk about pandemic proofing. If there were one thing for both of you that you would pray we did not go back to overlooking once we leave this, what would it be?
Well, initially I talked about the insurance issue. So we've talked about that. So I won't say that it's my one this time. I would say we need more clinicians. There needs to be a more pipeline approach to getting more clinicians into healthcare that will stay. Many of my colleagues have already reached out to me about how did you transition out of clinical practice? Because after this is no longer for me. And I'm concerned. I'm very concerned because I know what it's like to work 14, 16 hours and go 9 hours without a bathroom break or not eating. And I know what it's like to take care of people that are dying in the worst point of their life. And it can be emotionally taxing and mentally. So we need some type of plan that starts from childhood, that starts to tell how important and how great healthcare, the great things about healthcare. Then you think about your areas that are already underserved, the rural areas, the inner city areas. Typically, the patients are sicker, the workload is more, and the clinicians make less money. So how can you incentivize something like that for someone to come and actually stay, not come get their student loans and then they're out, So those are some things I would love to have that conversation. And in addition, even though this is a more of a state level issue, it still affects our country, is giving nurse practitioners full practice authority. Statistics show they practice in areas like rural, underserved areas, mountain regions that are not so much attractive to everyone else, But if they don't have full practice authority, it limits their ability to be able to provide care. I know a nurse practitioner run clinic in a rural area that had to close its doors because the overhead fee for paying for a supervising physician was too expensive. So this provider had a supervising physician that they talked to 2 times in 7 years. They paid several $1,000s a month because by law they had to do that. But now this whole clinic area that had over 1,000 patients no longer has a medical provider. The nearest clinic now is an hour away. An 80-year-old is not driving an hour and away to go get their blood pressure checked. It's not going to happen. So what can we do to make sure that we have a solid workforce that's, one, well taken care of, and two, who wants to stay for the long term if this is what they're called to do?
I think the answer might lie in the fact that we need more medical healthcare people in politics. We need more, because I mean, I was just looking at the coronavirus task force. They're like out of, I think there are 16 people on the force, and I think about 5 or 6 are physicians. The rest are non-physicians. So I think if you have more physicians or more medical care workers in politics, that would help inform politics, because they're things that look good on paper. If you've been in the trenches and you already know, that is not going to work. It looks good. A lot of things that look good on paper, when you actually put them into practice, you see, something, instead of this being on the left side, it really should have been on the right side. So, I mean, by getting, and maybe that could be our fault as medical providers. Maybe we shouldn't shy away. Maybe we shouldn't say, oh, those politicians. No. We should get in there. Maybe we need to also run for public office, and then we can inform some of the policy that's being made.
I love that.
Carolyn, did I just hear you announce your bid for Congress? Is that right? I think we just heard that. You heard it here first.
There we go. You got my vote.
You got my vote.
That is so good. Well, ladies, thank you so much for your time. And, I just want to remind our audience, between these two, we have over 40 years of experience in healthcare that you have just heard from. I want to take a moment to give each of you a minute to be able to, just a couple of seconds, to be able to share how can people connect with you and stay in touch with you. Dr. Felice?
Sure, absolutely. So I have an email list that I periodically send out: inspiration, health tips, stress reduction. And the best way is I've created a free gift of basically using adversity as an accelerator in your life and how you can position that. So if you go to www.yourwinningmind.com, it will deliver, put in your name and email address. It will deliver the free brochure and guide, and then you'll be connected to my email, all my social media. And I would love to hear from you guys. If you have other questions after this event, email me, send me social media messages, and I'd love to stay connected.
Awesome. That's yourwinningmind.com.
Correct.
Great. Thank you so much, Dr. Felice Carlton. We appreciate you. And Dr. Richardson, how can we stay in touch with you?
Yes, well, I also have a website. It's doccrich.com, www.doccrich.com. And I also have a YouTube channel where I have a lot of videos on there about healthy living, healthy eating, because I have all of that on there. If you go on my website, there's a lot of free ebooks that you can download that have information on there about how to make good, healthy food choices, how to get started in an exercise program. I mean, these things are, and you can just, with a click of a mouse, you can download and get information.
Beautiful. Thank you so much, ladies. We appreciate you tuning in tonight. We thank you so much.
Thank you.
And Jade, this is now our time. We want to be able to hear from you. What is it that you would do? What is the pandemic-proof plan that you would have for our country? And what is your ideas on our economic recovery? I'll let you take it from here.
Of course. What I think is so important right now is that as we hear from our leaders, what I'm realizing nobody really wants to hear or see is us spending all of our time pointing fingers at the other side or the people who believe or have responded differently. People are just saying, what would you do? And in the spirit of that, it's become increasingly important to me to make sure that whatever I release is clear, is concise, and just makes common sense. Operation Restoration exists to present common sense, common ground solutions that more and more Americans can feel comfortable rallying behind. And in that vein, I've been working on something called the Daniel Plan for pandemic proofing the nation. You know, a nation as great as ours should never ever be caught standing flat-footed in our citizens' greatest time of need. So I think we have to use the lessons we're currently learning, and we've got to redeem the time that we've lost by course correcting. And we get to course correct now in relation to our future. So the next president is going to have to not only be a believer in how great the country is, not only want the country to win, but they're going to have to take stock of our most significant weaknesses. You cannot improve as an individual, as an organization, and definitely not as a nation without taking powerful personal inventory. I think America is unique. It has unique needs. And while we must determine and never be dependent on other countries, we would be out of our minds not to learn from other countries. I saw one of the comments saying, why don't we just do what South Korea did? Well, we didn't have those points of contact. We've been so busy isolating in the last few years that we've taken back the points of outreach that we need that could have been used so much more effectively and quickly to our benefit. So up ahead, I believe, you heard me say this at the beginning, is a new era. I believe that era is of great promise and possibility, but if you will oblige me, I will have to be honest and say, it does not pretend that, it doesn't allow us to pretend like we're not going to see more periods like this one. I do believe that even in a golden version of a new normal, we're going to encounter hard periods like this. I think we're going to see these things more than less. Here's a hard thing I'm going to say. Everybody's eyes have been on us, the number one country in the world, the wealthiest nation in the world. You better believe that our allies have been watching, but you better believe our enemies have been watching. And I always say, what are your enemies learning by watching how you respond and react in your times of crisis? You better believe they're taking notes. And so we now have to begin to pandemic proof for the future, because whether or not you believe this was a naturally occurring virus, some of you have heard the conspiracy theories that exist. Some of them sound pretty convincing if you look at them deeply enough. We're going to have to understand the fact that possibly in the future, there will be evil people, evil nations that will use things like viruses as weapons. And so we need to be prepared. We can't be caught standing flat-footed. I call the plan the Daniel Plan. Any of you who know the story in the Bible of the exceptional boy named Daniel, he was basically, long story short, living in exile. He was an exceptional guy, very smart, could speak multiple languages. That brilliance of his got him recognized by the administration of the time, the leadership of the time. Over time, he grew to be second in command under this foreign king. And he also had this brilliant ability to interpret dreams. One of the dreams that he interpreted for the king, he was able to deduce that in 7 years, there was going to be an extreme famine. So what he did was, in the 7 years that he had, he didn't just wait for the extreme famine to hit, he prepared. I believe we now must enter a period, our new normal must contain what I call perennial preparation. That means we don't just prepare in the midst of crisis, we continually prepare even when there is no sign of crisis. So I think that we, being the wealthiest nation in the world, we're the role model. We have to have a response in advance. A reaction is what happens in real time. We've seen people react, we've seen our leaders react, and the outcome has not always been good. It's taken us a while to get on our feet. I believe now we have to plan our responses. So there's a mode of operation that I believe we have to adhere to. I'm not going to be able to get through the entire plan tonight. I look forward to releasing it in printed form later this week. But I wanted to give you a few of the highlights that excite me the most. When we talk about reopening, there's a very strategic way that we have to do that. When we talk about jumpstarting the economy, there are some exciting, innovative ways that we get to do that. But I think everything we do must be done in prudence. And when I say prudence, I mean there has to be, we need to start making our moves at the height of our intelligence. So what we've seen is that we get a little bit of information and then we move hastily and we didn't take all the calculations under concern. And so I think we have to begin now to be more patient. You have prudence, you have patience, so that we're going to adhere to the aggressive measures we decide on for longer than it's comfortable, so that when we do start back, we're in a better position. We must always operate in power. What I mean by that is we have to dare to take the authority that we do have. I believe that our president, whoever is president in the next crisis, whoever is president as we come out of this one, will have to use authority. How does that authority get used? Well, because of the way our Constitution is set up, thank God, we can't, as president, just dictate everything that the states do. But we can dare to put our personal gain on the line and dare to persuade and use the most convincing information possible to get the nation to move in a more unified way. So we must have a unified national strategy, and we must allow states flexibility to operate within the protocol, but we have to have protocol. The part that I'm going to emphasize tonight is this fourth part called perennial preparation. So I think we no longer, we all know this, we can't wait for epidemics to strike in order to take action. So upon taking office, what my administration would do is that we would immediately, I'm not talking about January, I'm talking about November, where the president-elect kind of goes undercover and meets with their administration to be. I believe now part of every president's transition must be shoring up their pandemic proofing response. So what is our response going to look like to the pandemic that we know will come at some point in the future? And so one of the ways that we have to do that is I believe we now need to jumpstart the economy with an ongoing emergency preparation program. Imagine how many jobs we can create if now the nation is constantly in the process of preparing. And I want to go through a few of the highlights of how we can prepare, but I'm excited about it because it gives us new jobs, it boosts the economy, and it offsets undue burden on our healthcare system. Man, were we exposed. We owe our frontline workers so much coming out of this, and I'll talk about how we can begin to pay them back. Let me first go through perennial preparation, and then I'm going to end tonight talking about how I would reopen. Here's the hard truth. If we indeed are doing what I think we're doing, which is reopening too soon, and what I mean by that is even though we haven't necessarily given the go-ahead to reopen, people are already reopening. I was out today and I saw more cars on the road. I saw more businesses with cars out front. They'll all remain nameless, of course. And this is not what it looked like even yesterday or the day before. So immediately when we start speaking things, we have to understand that people are going to hear what they want to hear, and they're going to react how they already wanted to react in the first place, which is why the way we speak as leadership is so important. With perennial preparation, one of the things that I think we need to focus on is, first of all, making sure that we have a strategic stockpiling system. What was exposed was that the federal government didn't know what the state governments had. Some of the state governments didn't know what they had. I believe we now need a prescribed set of state guidelines for stockpiling, and we need annual check-ins to assure readiness. I think we also must engage our construction industry in the building of national storehouses in centralized parts of the country. I think we can also begin to enlist many of the farmers who have been hurting, not just because of this crisis, but because of retaliatory tariffs that we engaged in earlier in last year. I think we're now going to have to begin to enlist those farmers, talking about jump-starting the economy as well as preparing simultaneously for a future pandemic. We use them, we incentivize them, we pay them to produce products that we're going to need in a future pandemic. So outside of the normal things that they produce for their everyday existence, they would also be producing for the government to provide storehouse food. And I think this is a better solution than what we have just looked at doing, which is reducing farm worker pay. Shame on us for that. That's going to cost us in the long run. We're also going to need to beef up ethanol production. Nobody's talking about it now. Mark my words, you're going to hear about it in a few days. But we have a shortage of CO2. And what that means now is the very thing that we need to make sure that our food supply stays secure, that our water is drinkable, is now we're seeing a drastic decrease in that. I believe now we're going to have to begin to incentivize companies year round during certain periods to produce the types of products that we know we needed, but we didn't have this time around. So imagine now incentivize manufacturing of protective gear, ventilators, other universally necessary items through company partnerships with American companies. Look, here's what we noticed. We had to go outside of our borders to get things that we needed right away. That cost us time and it cost us money. We could have also been serving our people by investing in our own companies and our own economy. So we want to make sure that while we want to work with other countries, we're never dependent on them. We should be the ones in our surplus, which we're starting to do now. Kudos to our current administration. We're able now to give back to other nations that need it. And if you don't think we should be giving, you need to do your research about the effects that developing nations can have on developing nations, on already developed nations, when you don't make sure that their public health systems are secure. So there really is, we saw this, nobody was left untouched. And so we now have to begin to think in a more universally companies. You'll hear me say the word incentivize and prioritize a lot in all of my platform releases, because I think that's a crucial combination. I think we have to now begin to have predetermined testing sites. So you saw, if any of you watched the press conference today, you heard about how we built new facilities to help deal with testing. Now into the future, if we're going to be perennially prepared, I think we should be incentivizing new construction to go ahead and use some of the infrastructure we discovered during this pandemic. Imagine if we have new stadiums that are built with the capacity to do what I call an emergency flip. If you love home flipping shows, you know what I'm talking about. Imagine if the very stadiums that are sitting empty right now were able to have been flipped overnight into spaces that could accommodate the sick, spaces that could accommodate testing, whether we're talking about testing for the virus or testing upon reopening. I also think we noticed it was very glaring that our capacity in so many ways, we were overwhelmed. We just did not have the capacity. Dr. Felice Carlton talked about how healthcare workers are going to come out of this very battered. Many of you asked earlier, what do we do when it comes to healthcare? Some will ask on Friday in education about what do we do with student loans? I think one of the ways we can start to pay healthcare workers back is look at student loan forgiveness for healthcare workers. I think the last thing they should have to do is come through this tragedy and then go back to having to be laden by debt. So imagine if when we look at loan forgiveness, we can do it strategically. We look at the industries that we need more people in. We want to incentivize students, like Felice was saying, from a very early age to be excited about going into healthcare. What we don't want to do is get them in healthcare and have them realize they're not supported or they can't maintain themselves. We have the illusion that all doctors are filthy rich, and they are not. So I would love to look at, we'll talk more about this on the economy and the education sessions, having student loan forgiveness be prioritized towards nurses, and new doctors, so that we don't find ourselves overextended. Really quickly, I want to talk about a couple of different industries that I see us having the opportunity to build out, not after COVID, not after we reopen, but right now. When we talk about reopening, I mentioned earlier when the other doctors were on, that we just have to do a better job where being prepared to test more people is concerned. If we don't know who is sick, we definitely risk a resurgence. Even now with protesters who have the right, the freedom to express themselves, what they don't have the right to do is to infect other people. And there very much can be a possibility that people who are expressing their right to free speech now and wanting to reopen could be increasing the issues where this pandemic is concerned. I pray we don't see an uptick in cases following these protests. I know some of those numbers do look to already show that. So we have to be organized in our approach. We have to be sure as leadership that we are not speaking to you in a way that has any other motive than to keep people safe. First thing I would do in the reopening, for those of you who are asking, in order to be economically viable, I think we're going to have to earmark funds. We are going to have to earmark funds specifically to fund our public health system. We saw a drastic increase in the number of state and local health agencies. We're going to need to see a drastic increase in those agencies. But you should know, we laid off a lot of those people at the beginning of this pandemic. We're going to need to hire them back and hire more people. In order to do the testing that we need, remember, 500,000 in the least tests a day, we're going to have to hire about 30,000 new workers for public health agencies so that they can do the testing and the tracing of COVID patients. Nobody's really talking about tracing. You don't just test, you got to know where these people are. Have they recovered? Are they still contagious? This is a process that has to be covered, and it has to be covered for the most part manually. The good news, the silver lining, we get to hire 30,000 new people. I'm going to mention two other things that have hiring attached to it, while we're in the midst of the epidemic. What does that mean? It means we don't have to wait to jumpstart the economy, but we can do it without endangering the lives of people who have not been sick already. So one way we do that when we hire new people, what's exciting is that you create those new jobs. But again, you've got to think ahead. What that means is if they are hired because of a crisis, likely that job is not going to be permanent, it's going to be temporary. So we want to make sure those jobs go first to people who have been recently unemployed because of the epidemic. So they instantly have more income coming in. They're more likely to be able to get their job back afterwards, but they don't have to wait for a period without work. What we also want to do is rally what we have. So now you have 30,000 new hires who will no longer work in that industry once the pandemic is gone. Why not have them on reserve for the next time we have a national emergency, a national crisis? You'll have people who are already trained to operate in crisis times. They already will have the credentials. We'll have them in a registry. They'll be cataloged. And we're going to lessen the impact economically of people just not being employed, but being able to sign up right away to be a part of the solution. Many of you were asking, how do you become a part of the solution? This would be one of those ways. Community workers could be trained. People right there in your own neighborhood could be trained to help in these times. Number two, we have a tremendous opportunity to create another entirely new industry. This actually is not my idea. This one came from Dr. Carolyn Richardson. She said, you know, what are we doing with all of the medical gear, the PPEs? We're just throwing them in the trash, and they are going through the normal process of mostly being burned. They're being put into our landfills. We haven't done really an environmental impact study on what that stuff in our landfills is going to do later. But what if we could possibly create a new industry, put people back to work, jumpstart the economy, and do something good for the environment as well? And she talked about an entirely new industry of autoclaving this medical equipment. We heard President Trump talk earlier about, a few weeks ago, maybe the beginning of this, he talked about, can we recycle? Can we recycle any of this? Well, most of this medical waste is usually never recycled, but we have new innovations now that we could look into. Imagine creating an entirely new industry that allows us to recycle things like the booties and the garments that our medical workers are wearing. They're throwing that away every day. These masks are being thrown away. There are now systems and innovations that would allow us to recycle. We'd have to test that, of course, thoroughly to make sure that we're not being reinfected by our own creation. But just imagine for a moment if that's indeed possible. You now have a whole new system that includes delivery, pickup, recycling, autoclaving, making sure which means simply to make sure that those items get repackaged and are sold again. That's another new industry. I think we have another opportunity in our next stimulus package, and I think this would now need to be our priority, is to make sure when we talk about the economy that the money gets to the actual small businesses that need it most. And so we're hoping now as we watch the second stimulus bill get drafted, that we'll begin to see small business prioritized first. I would propose that that must become our mode of operation. We have to stop thinking of a top-down, trickle-down effect, because to date, it has never worked. And now the people who need the money most had to watch that money be used up and now have to wait in line all over again. We're seeing some great acts of generosity by companies like Shake Shack, I think Burger King as well, gave back their stimulus money because they admitted, hey, we could actually find our money elsewhere. And so they're giving that money back first. But what you're seeing is the result now of politics and profit being prioritized over the American people. I think our mode of operation must be moving forward that we always prioritize people over profit every time. The first thing I would do, going back a bit, is to make sure that we ramped up our testing capacity. We can't put all of our eggs in the antibody basket. So what that means is that more aggressive restrictions, making sure that we are maintaining social distancing, making sure that we probably need to stay home for a little bit longer. Those aren't the things we want to hear. But I promise you, we'll be much more upset if we go into the future and find out we have to restart all over again. I believe we have to turn towards being perennially prepared. We must stop the competition between states by creating ways for them to collaborate and work together. And we have to see now a unity between federal government and state government. And I believe one way that that will persist is if national government dares to take responsibility for the wins and the fails. And instead of hedging their bets, that they propose national strategies. Of course, governments will have to decide, state governments will have to decide, but it would be great to know that we have one protocol that we can all modify to meet each state's needs. What we've seen now is or we've seen just lack of information. And without even pointing blame, whether it's at the current administration or the Democrats or the American people or the media, I think it's a moment for us now to just say, what can we do differently? And it's two things. We must always prioritize people over profit and over politics and over partisanship. And we must look now to a future that includes perennially being prepared. And the way we do that is, I know one candidate has said before, we'll spend whatever it takes. We'll spend whatever it takes. I don't think we have to spend whatever it takes. I think we spend what we have, we spend what we need, and then what we do is we rally everything that we already have. We've seen a lot of people and companies and organizations gone underutilized during this that could have been really effective in helping us. Some of them are coming to the front now. And I think lastly, we make sure that we prioritize people and make sure that the people who have the greatest need don't continue to stay at the bottom of the totem pole, but that we don't only shine now, we shine it on them into the future, and we look for solutions that are sustainable, not just during crisis time, but that those solutions become our modes of operation. That's a lot to take in, and it's only the tip of the iceberg. We'll be releasing the Daniel Plan for pandemic proofing the nation very soon. I promise to release platforms in a way that you can understand them. They're clear, they're concise, and then we'll have ways that you can see more of the long form. But we want to make sure that the public has access to being able to see the crux of what it is that we're planning and what our vision is for the nation. I hope that some of these things have excited you, and we'll turn it now back over to Isis. But thank you so much for tuning in.
That is awesome. Thank you so much, Jade. We really appreciate you giving us an opportunity to hear exactly how you would address these issues that we care so deeply about. I think one of the things that is required for us in returning to a new normal is to have innovative ideas. I heard someone say very well that it requires big ideas, big hearts, and hearing innovative plans like that is really reassuring. So for those of you that have tuned in tonight, we want to say thank you. We want to also give you an opportunity to stay connected. If you text the word one nation, all one word, the phrase one nation, all one word, to 33777, you'll be able to get our One Nation card. This will tell you the 3 pillars of the movement and get you connected to our mailing list so that you can hear more about the movement. That's One Nation to 33777. We also invite you to check out OperationRestoration2020.com, where you can hear more about Jade's policies and platforms and learn more about her background as well, and see that she has the ingredients, the characteristics that it takes to lead this nation. And then we also want to make sure that you join us again. We loved hearing your comments. We loved hearing your questions. And we invite you back for us to join us this Wednesday, 7:30 p.m. Central Standard Time. And the topic is going to be on the economy. All right, y'all, we're talking money. The title of this is going to be A New Age of Affordability. So we welcome you all to attend. And we are so grateful that you have been able to tune in tonight. Please be sure to invite your friends and stay connected with us at OperationRestoration2020.com. We'll see you very soon on Wednesday night. Thank you again for tuning in.